are some information about herpes complex, but before we start, please don't forget to like and share and hit the subscribe button below and click the notification bell to make you updated for more videos. Now let's begin. Herpes simplex is a typical viral disease. In the event that you've ever had a mouth blister or fever rankle, you got the herpes simplex infection. Most mouth blisters are brought about by herpes simplex infection type 1 (HSV1). Different names for mouth blisters brought about by HSV1 are oral herpes, mouth herpes, herpes simplex labialis. After clearing, herpes simplex bruises can return. At the point when the injuries return, the episode will in general be milder than the main flare-up. A firmly related herpes simplex infection, HSV2, causes most instances of genital herpes. However, either HSV1 or HSV2 can cause a herpes sore on the face or private parts. Herpes simplex, signs and side effects. Numerous individuals who get the infection that causes herpes never observe or feel anything. In the event that signs, what you see, or side effects, what you feel, happen, an individual may understanding. Tingling, or consuming. Before the rankles show up, the skin may shiver, tingle, or consume for a day or something like that. Sores. At least one difficult, liquid-filled rankles may show up. Rankles tear open and regularly overflow liquid and structure an outside layer, before recuperating. The first run-through bruises show up, they will appear somewhere in the range of 2 and 20 days after an individual has contact with a tainted individual. The wounds can last from 7 to 10 days. Where the injuries show up regularly fluctuates with type. Oral herpes, HSV1, most rankles show up on the lips or around the mouth. Now and then rankles structure on the face or on the tongue. In spite of the fact that these are the most well-known spots to discover oral herpes, the wounds can show up anyplace on the skin. Genital herpes, HSV2, injuries regularly happen on the penis, vagina, bottom, or butt. Ladies can have bruises inside the vagina. Like oral herpes, these injuries can show up anyplace on the skin. In the event that an individual has HSV1, an awful burn from the sun can trigger a herpes simplex episode. Flu-like side effects. Fever, muscle throbs, or swollen lymph hubs, organs, in the neck, oral herpes, or crotch, genital herpes, are conceivable. Problems peeing. Individuals, regularly ladies, with genital herpes may experience difficulty peeing or have a consuming inclination while peeing. An eye contamination, herpes keratitis. In some cases the herpes simplex infection can spread to one or the two eyes. In the event that this occurs, you can have torment, light affectability, release, and a dirty inclination in the eye. Without brief treatment, scarring of the eye may result. Scarring can prompt overcast vision and even loss of vision. On the off chance that you create signs and side effects of herpes simplex, you can hope to have these however long recorded underneath: oral mouth herpes, half a month; genital herpes, 2 to about a month and a half. The main episode, herpes simplex episodes generally create around the mouth or on the private parts, however the wounds can show up anyplace on the skin. Herpes simplex, WHO gets and causes. Who gets herpes simplex? The vast majority get HSV1, herpes simplex sort 1, as a baby or youngster. This infection can be spread by skin-to-skin contact with a grown-up who conveys the infection. A grown-up must have wounds to spread the infection. An individual generally gets HSV2, herpes simplex sort 2, through sexual contact. About 20% of explicitly dynamic grown-ups in the U.S. convey HSV2. A few people are bound to get HSV2. These individuals are female, have had many sex accomplices, had sex just because at a youthful age, have or had another explicitly sent contamination, have a debilitated resistant framework because of an ailment or medication. What causes herpes simplex? Herpes simplex infections spread from individual to individual through close contact. You can get a herpes simplex infection from contacting a herpes sore. A great many people, in any case, get herpes simplex from a tainted individual who doesn't have wounds. Specialists call this asymptomatic viral shedding. How individuals get herpes around their mouth. An individual with HSV-1 herpes simplex sort 1 can pass it to another person by kissing, touching the individual's skin, for example, squeezing a kid's cheek, sharing items, for example, flatware, lip medicine, or a razor. How individuals get herpes on their privates. You can get genital herpes in the wake of coming into contact with HSV-1 or HSV-2. A great many people get genital herpes from HSV-2, which they get during sex. On the off chance that somebody has a mouth blister and performs oral sex, this can spread HSV-1 to the privates, and cause herpes wounds on the privates. Moms can give the herpes infection to their infant during labor. On the off chance that the infant is conceived during the mother's first scene of genital herpes, the child can have significant issues. What happens once you have HSV-1 or HSV-2? When an individual gets tainted with a herpes infection, the infection never leaves the body. After the principal flare-up, the infection moves from the skin cells to nerve cells. The infection remains in the nerve cells for eternity. Be that as it may, it typically just remains there. In this stage, the infection is supposed to be lethargic, or sleeping. Yet, it can become dynamic once more. A few things that can trigger, wake up the infection are stress, illness, fever, sun presentation, menstrual periods, surgery. Herpes simplex, finding and treatment. How do dermatologists analyze herpes simplex? During a flare-up, a dermatologist regularly can analyze herpes simplex by taking a gander at the injuries. To affirm that a patient has herpes simplex, a dermatologist may take a swab from a sore and send this swab to a research facility. At the point when wounds are absent, other clinical tests, for example, blood tests, can discover the herpes simplex infection. How do dermatologists treat herpes simplex? There is no solution for herpes simplex. Fortunately, injuries regularly clear without treatment. Numerous individuals decide to treat herpes simplex in light of the fact that treatment can calm manifestations and abbreviate a flare-up. The vast majority are treated with an antiviral medication. An antiviral cream or salve can calm the consuming, tingling, or shivering. An antiviral medication that is oral pills or intravenous shot can abbreviate an episode of herpes. Solution antiviral meds endorsed for the treatment of the two sorts of herpes simplex include acyclovir, famciclovir, valacyclovir. Thank you for watching. Please like and share.